Dear colleagues and friends, most welcome in this webinar, another webinar from GHD EMPHNET. Over the last 3 months almost we had a lot of webinars, and today we are going inshallah to talk about the role of FETPs and the rapid response teams as a first line responders during the COVID-19 pandemic. Most welcome everybody. As we all know that since the inception of the COVID-19 pandemic, countries around the world had implemented various mitigation and preventive measures with the aim to control transmission and reduce the mortality and morbidity rates. As part of the country's active preparedness and response plans, field epidemiology training programs, residents and graduates, and rapid response teams were directly involved in a wide range of activities as part of the preparedness and response activities to the COVID-19 pandemic. The field epidemiology training program and the rapid response training programs provide participants with the theoretical and the practical skills that should enable them to execute the theoretical concepts on the ground and to provide hands-on experience. The role of FETPs and the rapid response team is to strengthen the country health system and to detect, notify, and respond to the events that threaten the national and international health. Being an integral part of national health system, field epidemiology training programs and rapid response teams have been deeply involved in activities responding to the COVID-19, including surveillance, case investigation, points of entry arrival screenings, isolation protocols, transferring cases, risk communication, and training on infection prevention and control. FETPs and rapid response teams have proven in many countries to be a key asset in responding to various public health emergencies, specifically the COVID-19 pandemic. In this webinar, we will try to highlight the various activities undertaken by field epidemiology training programs and rapid response teams during their response to COVID-19, identify the areas of strengths that we need to build on, and the gaps and weaknesses that we need to address in the coming times. Also, to elaborate on the importance of data management, documentation, and involvement of the FETPs and rapid response team in operational research on COVID-19, and to explain the institutional setup and synergies with other public health bodies. In fact, I would like, first of all, before we have 3 distinguished presenters here today, and we have also 2 colleagues from another 2 countries who are going to be the panelists as well in this webinar. And before starting, I would like to introduce my colleague, Ms. Heather Berg. She will be a co-facilitator in this webinar. And Ms. Heather, she is the CDC Regional Director for the Middle East and North Africa. She is based now in Muscat, Oman. She worked with CDC Division of Global Migration and Quarantine on U.S. refugee resettlement activities over the past 4 years as the Regional Program Director on detail to the International Organization of Migration, the IOM, based in Amman, Jordan. She holds an undergraduate degree from Boston College and graduate degrees from both the Johns Hopkins University School of Public Health and School of Advanced International Studies. In fact, we are going to cover the regional situation or the regional impact of engagement of rapid response team and FETPs in the response to the COVID-19. And we have a distinguished speaker, really, Dr. Mohanad Al-Insour. Dr. Mohanad Al-Insour, I think most of the attendees now, they know him in person and since a long time, probably. And Dr. Mohanad Al-Insour, he is the Executive Director of Global Health and Development, Eastern Mediterranean Public Health Network. And Dr. Al-Insour, he is an internationally recognized expert in the field of epidemiology, research, and public health systems. After getting his MD, Dr. Al-Insour had an MSc in epidemiology from the American University of Beirut, AUB, and a PhD from Glasgow University, UK. And he was the director of Jordan FETP for a long time, in fact, and he served as a CDC consultant for FETPs in the Eastern Mediterranean region. He also served as a consultant on several assignments with the U.S. Center of Disease of CDC, the WHO, and also with the AUB. Dr. Muhannad, the floor is yours. You have 15 minutes to elaborate on the regional aspect of engagement of field epidemiology training programs and rapid response team in their response to the COVID-19 pandemic. Please, the floor is yours.
Thank you very much, and for the introduction, and allow me first to do some exercise sharing my screen, and thank you very much, and good evening, good afternoon, and good morning for everyone, and thank you very much for giving me the opportunity to present the role of Eastern Mediterranean Public Health Network, EMPHNET, in supporting field epidemiology training programs and rapid response teams during the COVID-19 era. During my presentation, this is the outline of my presentation, where I will start with background and brief overview on field epidemiology training program. Then I will move to rapid response teams initiative, and then we will talk a little bit about the current situation of COVID-19 in the region, and then we will move to major response activities undertaken by FETPs and rapid response team during COVID-19. It's very important, as Dr. Faris mentioned, it's very important to address our gaps and challenges within COVID-19. And finally, I will end up with explain, or briefly explain the EMPHNET support areas. So Eastern Mediterranean Public Health Network, EMPHNET, is working closely with ministers of health and partners to build the capacity of health workforce, supporting operational research and developing the innovative solutions to public health challenges. EMPHNET is working, it's the only network for field epidemiologists in Eastern Mediterranean region. Hence, it's a provide platform for experience, exchange, and communication among FETP programs. EMPHNET works to strengthen FETPs by providing technical assistance and facilitating training in Eastern Mediterranean countries. EMPHNET aims to build the core FETP competencies to assist countries meeting their core capacity requirements for surveillance and response under international health regulations, IHR 2005. So I am sure many of us, familiar with FETP. Just a few words about field epidemiology training programs. FETP is an applied public health training program modeled after the U.S. Centers for Disease Control and Prevention, CDC, Epidemic Intelligence Service, EIS 1951. FETP is established with the host country ministries of health, mainly to enhance the epidemiological capacity of the public health workforce and increase the use of science and data to efficiently and timely respond to public health threats. FETP residents and graduates participate in outbreak investigation, helping to establish and evaluate disease surveillance system, designing and conducting studies on problems of public health concern in their countries, and finally, they are contributing in training other healthcare workers. Field work is typically conducting under the supervision and guidance of an experienced mentor. So this is, this slide is very important, where we can see the different modalities of FETP programs. Mainly, we have three modalities of FETP. The first one is advanced FETP or national FETP, which is focused on building the capacity of the national level, country level, and it's mainly 2-year program. Second type, it's intermediate regional level, and it's focused on building the capacity at the governmental or provincial and regional level, and it takes almost 1-year program. And finally, the basic local level, which is, 3 months program, and we call it here at the region public health empowerment programs. As you see, so far we have 10 countries in the region that they have their own field epidemiology training programs. Some of the countries, they have more than one of the modalities, but mainly, at least we have 10 countries have one one model. These countries namely are Saudi Arabia, Egypt, Jordan, Pakistan, Iraq, Morocco, Yemen, Sudan, Tunisia, and Afghanistan. And it depends on the capacity that we need to build and the level of these programs. As I said, we have public health empowerment program. It's mainly focused on basic field epidemiology to make sure the periphery is aware of the data management, surveillance, and other duties. Moving to the Rapid Response Team initiative. So this initiative was established in 2012 by EMPHNET, and the main purpose of this initiative is to contribute in building national and regional rapid response team, strengthening emergency operation centers, responding to disease outbreaks such as cholera, SARS, chikungunya, and others, supporting the development of national and subnational health emergency plans. If we look at number of rapid response teams per year for Eastern Mediterranean countries that had been trained by EMPHNET, we can see that the number is increasing with time. And nowadays we have more than 600 graduates as rapid response teams in our region. To look at the number of rapid response team trainees by the country, we can see that we were working in the past years with different countries in the region, with Tunisia, Sudan, Morocco, Jordan, Iraq, and Egypt, and many other countries. This slide shows the number of rapid response team trainees at the level of training. As I said, we need to make sure that we are training in different levels, at the national level, at the government level, or we can provincial or regional level. At the same time, we have to go deep to the periphery and to the localities as subnational level. So in general, what we are doing is not detached from the globe. So we are part of the globe, and we are doing some work related to global health security agenda. Nowadays, EMPHNET as a platform for FETP programs, we are a member of steering committee for GWAN, which is a Global Outbreak Alert and Response Network. Of course, we are working very closely with TIFNET, and we are a member of Rapid Response Global Network, GE Alliance, and many other international and global initiatives in the world. This shows that the role of FETPs and rapid response teams in responding to different outbreak response and public health threats. We see that some of them depends on the mobilizing the resources within the country, and sometimes we are deploying people from country to another, and sometimes we are taking a role as a part of facilitating and coordinating the international level. So this is our small example from Yemen, where we were working closely with Yemen Ministry of Health, in establishing public health empowerment programs during the cholera outbreak a few years ago in collaboration with the ministry. Again, we are part of the globe, so we see that other contribution and other, coordination took place with sending FETP fellows to be part of the Ebola outbreak response in Africa. And this is the picture from our colleague from Morocco, was deployed to Sierra Leone. Back to COVID-19. As you see, I think this is WHO slide, just as you see, and it's explained the distribution of COVID-19 confirmed cases in the Eastern Mediterranean region. And as you see, the number is increasing, and still we have very highly affected countries in our region. And we should remember that this slide shows only confirmed cases. Again, this is another table from WHO, but this time from the regional office, EMRO office, and it explains, few more information about the new cases, new deaths, total cases, recoveries, fatality rate, case fatality rate, test and positivity ratio. Just allow me in this slide to highlight the importance importance of the positivity ratio, where in certain countries in our region, we reach almost 40% of positivity test ratio, as shown in the table. So major response activities undertaken by FETPs and rapid response during COVID-19. Mainly our activities focus on surveillance, case investigation, contact tracing, screening at the airport and other point of entry, developing and disseminating protocol and standard operation procedures, training on infection prevention, protocol and other areas, data collection, management and analysis, developing reports and policy briefs, participate in development of national preparedness plans and response, develop and disseminate health education messages for preventive measures, including quarantine and isolation, and managing emergency operation system operations, and participate in high-level policy making. It's very important also to address our gap and challenge. As you know, Eastern Mediterranean region is the region with conflict, post-conflict, and unstable political system. The situation poses significant challenge to secure enough logistic needs and support to certain area, like in Libya and Syria. Absence of established FETPs in many countries in the region. Some countries still do not have an established FETP program that would facilitate coordination and support. As you remember, especially at the beginning of the outbreak, we witnessed severe shortage of PCR and PPEs in many countries in the region, and still risk communication and community engagement and awareness activities are not effective to limit community transmission and prevent panic. Insufficient data collection, documentation, and information sharing among sectors in countries and across countries, still a major challenge for us. Inability to provide support due to time as a result of logistic barriers, such as travel bans, country lockdown, availability of the internet, and many other reasons. Infection prevention and control gaps were noted by the significant transmission of disease to healthcare workers. So the areas, just GSD EMPHNET support areas, mainly we focus on increase the number of trained FETPs, rapid response, and volunteers through providing refresher training before serving in the field. We work to increase the capacity of infection prevention control practice through online and offline training package, support safety and safe laboratory practices, assist in documentation, and making relevant information available via different communication channels. Maintaining communication with partners to coordinate response through teleconferences and one-to-one communication. We focus on pre-assessed countries' priorities such as surveillance and contact tracing or point of entry, enhance coordination and information sharing through multiple sectorial coordination and collaboration, support risk communication and communication engagement through enhancing the coordination between public health and media sectors to limit misinformation that we witness in the region. Data collection and documentation during the response to strengthening response to the current and future outbreak. Exchange experiences among countries to enhance intra-country collaboration and coordination. This picture from the region where we can see that different FETPs programs are engaged in the response, in the response for the COVID-19 outbreak. The message that I like to send here that this modality of the training like FETPs and rapid approach, they are very helpful to their countries. We witnessed that ban of the travel, limited external consultancy or external support. These programs were be able, to provide the support for their countries. So I would like to thank all FETP programs and rapid response team programs. Thank you very much. Thank you.
Thank you so much, Dr. Mohanad, for this great presentation, really, and very, very up to the time, really, less than 15 minutes even, so we are going to get use of the extra minutes that you offer us. Really, I think what you mentioned is very important. That EMPHNET was really a platform for the countries in the region, not only for FETP, even for ministries of health. Here in Iraq, for example, we have frequent communication with EMPHNET in order to get use of available guidelines, SOPs, etc., from different countries in the region. So, thank you so much for that. Doctor, just a point here, we would like to inform all the colleagues that if you have any comment, any question, please, you can use the Q&A button at the bottom at the bar of your screen. So if you have any comment, and then we are at the end of the three presentation, hopefully we will have the time to address all of them. So please feel free to put your comments or a question. Now we are going to have the experience of two countries in the region first, and we will see the role of FETP and the rapid response team, how they operated during the current COVID-19 pandemic. We will start first of all with Pakistan, and we have a very respected colleague, the Professor Amir Ikram. He is the Director of National Institute of Health in Pakistan. He is the Executive Director also of the clinical Director of Field Epidemiology and Laboratory Training Program. Dr. Amir Ikram holds a PhD in molecular biology. He was awarded the FRCP by the Royal College of Edinburgh, FRCPAT by the Royal College of Pathologists in London, and a fellowship in public health from the Royal College in UK 2018. He is a fellow in the Pakistan Academy of Science, and he is the president also of the Pakistan Biological Safety Association. Very, very rich and very extensive CV. Thank you so much, Professor Ikram, for having you here in this webinar. And the floor is you to highlight the experience of Pakistan and Pakistan FELTP in the COVID-19 pandemic. The floor is yours, please.
Thank you so much, Dr. Faris. First of all, my deep gratitude to all of you, and especially to EMPHNET for providing this opportunity of sharing the experiences. I think the whole globe is suffering, and with all that, definitely we all are facing the same challenge. But I keep repeating that such challenges always provide opportunities. So we have to catch those opportunities. And I think one of the things we have been able to manage at our own level, whatever level, and a lot many successes and lot many gaps. So I think this is the best time that we share those gaps and analyze them. So God forbid any future eventuality, we are very well prepared. But I think there's been a lot of learning. A special thank to Mohanad and all the colleagues and all the team for making it possible for me. What I'll be concentrating briefly is the COVID response, especially the FELTP Pakistan. Can I have the next slide, please? Well, just a little bit of background. It was initiated in 2007, a joint venture of National Institute of Health, the Ministry of Health, and CDC US, and definitely supported by DEFNET and EMPHNET thoroughly throughout this period, aimed at developing the cadre of field epidemiologists, and that was a new trend, and I think that has been a great success, which is proved during this crisis period. The main objective was basically to strengthen the IHR core capacities for working in the real-time surveillance. Up till now, we have 11 cohorts which have passed out, and the 12th and 13 are basically under training. Next slide, please. As very rightly pointed out by Mohanad, the three pillars and categories moving on to the advanced level for 2 years course. We have had 13 cohorts, out of which 11 have passed out with 208 graduates, and 61 are still under their finalization. And as far as the frontliners, the 3 months course is concerned, we have 13 cohorts with 297 graduates. And more than 1,500 persons have been trained through short courses in almost all parts of the country. Next slide, please. A little bit about the accomplishments. Right now, we have 20 functional disease surveillance and response unit at the district level, as you can see on the map, and they span all across Pakistan. And once again, I would like, this has been one of the main strengths in collecting the data throughout the country. Well, it has recently been accredited by EMPHNET, and which definitely adds to its charter. And we have regular acceptance of annual EIS conference papers, highest number of accepted extracts in 2018. And we have also converted into a master's program through one of our universities. And up till now, 40 of our graduates have already qualified the MSc Field Epidemiology as well. Next slide, please. Multiple distinction, just briefly, the CDC Director's Award for Excellence in Outbreak Investigation in 2016. We underwent joint external evaluation, and we were the first country in the region. And we were marked with good numbers as far as our capacities in this field were concerned. And the Independent Oversight and Advisory Committee of WHO regards this program as a successful model for building national workforce capacity, and an exemplary model which might be of benefit to the other countries. And that's the area definitely we would like to share our experience in future as well with all the regional countries. Next slide, please. As far as COVID is concerned, we have the first case detected on 26th of February, and then definitely allied so many restrictions coming in, the local transmission once started spreading. Most of the cases have been reported from Punjab and Sindh province. But the successful control of disease, I would say it's still not over, but I think a lot of tremendous efforts at the national level by the government of Pakistan, and then establishing a national command and operation center, which provided an umbrella to all of us to work in a very harmonized manner with serial smart lockdowns, active contact tracing through these trained teams, and establishment of emergency operation centers and the National Command and Operation Center, and development and dissemination of standing operating procedures, and so many other advisories and multiple roles. Next slide, please. Just to give you a brief of what is the COVID situation in Pakistan, alhamdulillah, as you see, after reaching the peak and plateau, and then we are coming down. On average, we are having less than 500 cases per day, which is detected. And as you can see, multiple initiatives taken at different points during this period. And we have a formal dashboard from the ministry side as well. Next slide, please. The scope of work in COVID response, I would say that more than 90% graduates of the advanced and fellows on the front line have been actively involved. And this is, I tell you, has taken as a true success. And that's what we are now putting in our governmental farming grants for continuation and rather further elaboration of this field epidemiology course. And I'm sure, inshallah, with our efforts and your support, we will definitely contribute a lot towards times to come in the near future. The DSRUs have been the main hub of coordination, and 20 already functional. And I think the rapid response team running all across. We did conduct a survey on the 8th pillar based upon the coordination, planning, monitoring, the risk communication, surveillance, rapid response teams, the point of entries. I think the main pivot, we have got 19 point of entries, including the land, air, and sea. And I think this is the first ever experience to such a vastness whereby all the facilities, I hats off to my teams from NIH, including all these FETP graduates who have been rushing all across the country from time to time and still continuing that and imparting training right. It's not only the preparation of the advisories, SOPs, but actual implementation on ground, the triage, the drills, hands-on exercises. It's been immaculate, alhamdulillah, I would say, and a lot of learning coming out of it. And I'm sure with this experience, we can launch much formidable processes in the near future. Then talking in particular about the national labs, just to share, we started off from a single lab in the country, and right now 145 labs are performing this PCR testing all across the country. And from a daily capacity of almost less than 1,000, we rose to 150,000 per day. Now that definitely the contribution going, sampling, moving around, transporting sample, all credit goes to our FETP graduates who have performed again immensely in this field. One of the main areas has been infection prevention and control. I think this has been the biggest challenge because all the paramedics, the frontline workers, they've all been faced with the threat of COVID. And lot many trainings have been conducted. Briefly, I'll touch those as well. The case management and the operational support and logistic. I think these are the areas. And I will little bit share in, especially in the last two areas, we definitely have certain gaps. But the good thing now that we know the gaps, we can address them shortly as well. Next slide, please. If you see the coordination, planning, and monitoring, we had 568 participants, and we set up the incident and command system for which the graduates performed, I think, very well. And the main thing that has been addressed in this regard is the Emergency Operations Center, whether it was at the national level, the provincial, or regional level. And setting up those rapid response team, getting to the precise areas, getting the precise data. And I think data is the main success for any such eventuality. And hats off to all the colleagues who have been running around. And right in the danger zones, once you talk of high burden areas, it's been exquisite. Next slide, please. Now, this is the main National Emergency Operations Center at National Institute of Health. And from here, we definitely transmitted everything to the National Command and Operations Center. This has been functional for the last almost 6 months now, no weekends, no holidays. And we have the contact tracing teams, I would say, multi-million calls have been made. Just to give you an example, that the first case that we detected on 26th February, we traced out contacts numbering 267, which was again done by all these FETP teams at the federal level, because the first case was detected in Islamabad, and around 100 contacts in the second case that was detected in Karachi, that the farthest end of Pakistan now. So not only that, we have established an emergency helpline, 116 number, and we thoroughly utilized the expertise of these colleagues in responding to the queries, because in the initial days, there were a huge hoax, and definitely the psychological impact on the society. So that was a big challenge, which was picked up again by colleagues, and then they prepared master trainers, and then they took on the job. The good thing was that these people have been putting in their efforts and then moving on to the next thing. We launched a concept of master trainers throughout, whether it was IPC, whether it was rapid response teams. And right now, a good number of rapid response teams have been trained throughout the country through help of different donors and partners and the government of Pakistan. And we think we have been quite able to not only treat, manage, but also impart training during this crucial period. Next slide, please. Now, again, as I said, one of the main components has been risk communication. They have been quite forthcoming in establishment of communication mechanisms. And the best part that they played has been the dissemination of message. And as I said earlier, I mean, just preparing SOP is one, but actual drill triage, they make and gauge the success of any SOP or any program. We at NIH have been responsible for issuing all those advisories, and the ministry then launching those SOPs, but the actual manifestation and dissemination has been a big challenge for a country like Pakistan, which has been amicably handled by the FETP graduates and the master trainer then that they prepared. Next slide, please. We, as I said, communication formed the pivot during such, whether it's the data reporting, whether it's getting the data, whether it is the case management, to the precise extent, we developed and evolved the system whereby we precisely know the number of beds within the country, how many patients are ventilated at one time, moving on to the level even high and low flow oxygen patients. So that's the way we would actually monitor the actual state in the country, and it has helped us a lot. And again, if we consider our FETP graduates, they've been moving around, and I think they have faced many challenges. And even going down to convincing the people, once we started off whether the seroprevalence study or we wanted to have random sampling, it's a bit tedious job convincing the people. So there, I mean, one of the way of communication skills, I think they have really evolved in picking up such challenges. And as we started the other processes, these communication skills, again, belonging to these FETP graduates, have been thoroughly utilized in dishing out the SOPs, making the people understand proper messaging through all the sources that we could attain in our country. Next slide, please. The surveillance, rapid response, case investigation, I've said a lot, but just on the statistical side, I think one of the main successes for these graduates have, especially the fellows and even the present graduate, we wanted to poll the cohort, the 12th cohort for contact session, and it was amazing. All the provincial government started requesting straight away to us that we should delay it because they were already utilizing their capabilities. So this speaks volume. It's not only the fellows who have already qualified, but the current graduates as well. Even the next cohort that has been selected, they marked them, all the provincial government and the two regions, and they started utilizing their expertise. So I think it's going to be a great internship, the new fellows coming back and again completing their trainings and again moving out. So hopefully we are calling the cohorts in mid of September for the contact period. And if you see the rapid response team and contact tracing, this has been the hallmark of our success as far as the case tracing and is concerned, the sampling is concerned, and then bringing back those samples. I mean, multitude of sites. We started off with the random sampling, then the sentinel side, then establishing different sentinel side into the more non-medical areas, moving out of the hospital, whether it's the markets, the cinema halls, what and what not. So it's been immaculate if we see the overall success. This is the main area where they have performed exquisitely very well. Next slide, please. As I said, 19 point of entry, the main problem has been the air route and the land to a certain extent, but we were able to manage the land because it was one of the far-off areas in Taftan where we started having initially pouring enough cases, but again, amicably handled over there. But these teams have been moving out to all the point of entries at different places and imparting hands-on training. And our main institute that looks after the point of entries is the Central Health Establishment. And we started training. And fortunately, we picked up this challenge 6 months before the COVID crisis, once we thought of the gaps and we started training. But that training played a very important role because it was standardized based upon COVID. And as you can see on one of the photographs on the lower side, this is the Islamabad International Airport and how well they have been prepared before any flight arrives for a stringent screening and everything moving on from there to till the hospital or the quarantine. Next slide, please. The National Provincial Public Health Lab, I've already talked, and because definitely this is the area where they were not directly involved with the lab expertise, but the main thing which they did, as I said earlier, has been the sampling. Anywhere, everywhere, going down to houses, going down to the deepest drains and picking up those samples. It's, I think, being a pathologist myself and a microbiologist myself, I think this is something which needs to be applauded, not only in Pakistan, but all over the world. And in the region, especially, I'm sure the FETP graduates and EMPHNET and all the other, we hear a lot, many success stories. And inshallah, time will come when we start writing those stories and start sharing those stories at the regional and global level. Next slide, please. One of the successes, again, has been their imparting training in infection prevention and control. Even as you can see, I mean, with the graduates, 70%, I think that's a huge number because one of the things that has been faced all of this crisis has been faced all over the globe. If you talk of the paramedics, the frontliners, and I include the frontliners, it's not only the medical side, the non-medical side, you talk of the law enforcement agencies. So we have been picking up with all the agencies, whether the ambulance services, the fire brigade, what and what not. We try to collect them, we try to train them, and I would debut all the credit again to the FETP graduates and the master trainer that they prepared. And NIH, I say, is their home. And I always say, I assume the position of a father. So I think it's my pride that the way these teams have performed, alhamdulillah, that we manage these things. And right now, these are online trainings which are ongoing. Can I have the next slide, please? Yeah, here you can see this Center for Occupational and Patient Safety. I especially I named it as COPS because I want to behave them COPS. And this is the training center which is right now providing online training, covering up all the aspects and more so on the hospital infection for paramedics, medics, and moving on to the law enforcement agencies. And these FETP graduates is in the same building where we have FELTP on the ground floor, and they remain part and parcel of all such activities. Next slide, please. Case management, moving on from the detection to they definitely the graduates made available for self-care of the patient, which is quite amazing. They've gone beyond their domain doing these jobs. So this is yet another area. But next slide, please. If you this is the area I think which we if you see the operational support and logistics is performed nearing 50%, but this is the area where I think we need to develop more managerial skill, more so on the operational side, more so on the administrative side, where we need to build up and mentor them to a far more extent. And I'm sure this will definitely make a lot of tremendous different thoughts which we can share on certain different platforms, that how to launch such managerial course for these. One of the example is the GLLP, which we just finished off the cohort with WHO today. That's an excellent example of the Global Lab Leadership Program, and maybe a shorter version of some program be included to enhance their operational and administrative skills. Next slide, please. Now, this is the success where these guys have worked. This is the TTQ Technology, which is the tracing, tracking, tracing, and quarantine. And we have been very successful because we started this much earlier in the country for detection of the hotspots, then the telco-based tracking and current address-based tracing, and then definitely either getting them into the self-quarantine, or in case of symptomatic, depending upon the mildness to moderate to severeness, shifting them to the hospital and treating them appropriately. Next slide, please. So basically, this is the TTQ technology integration with the TTQ call centers, which happened just during this crisis. And I'm sure this technology will be utilized thoroughly with any such eventuality, God forbid. I mean, it's been a tough challenge, but I think this will prepare us for any future modality, but can also be utilized for so many other endemic diseases. And that's what we are planning, the integration of all such developments into the national hub. Next slide, please. Now, this is the example of national, basically IT board with smart lockdown strategies. And here comes the role of these guys, and where they have been going around, tracking them, tracing them, and then putting them with the help of law enforcement agency for the lockdowns. And then from that moment, next slide, please. We moved on to a stage where we had hotspots from the massive lockdown all over the country, moving on to hotspots for within a city and going down to a level of smart lockdowns. And now we are moving toward the micro lockdowns presently. Next slide, please. Their role has been highly applauded. I think if you see the previous EMPHNET Voices from the Field, one of our graduates who I would like, Bisma, she took the first position. This is just only that, not only that, we have the appreciation from the National Command and Operation Center. And top of the line, you see in the middle, Honorable Prime Minister Imran Khan standing with us after 100 days of completion of the National Command Center, and one of the graduates just standing close to him. So this is the strength of the system. You develop a strength and you're honored, and we take it as a huge honor by our Prime Minister for this program as well. Next slide, please. We never forgot the research, and it's the operational search, just to mention a few. And yesterday I was just seeing that we have submitted almost 21 papers in the international journals, out of which 6 have been accepted, some are in the pipeline, and some are in the peer review processes, and all hard work of teams at NIH, and definitely including the FETP graduates. So I also realize their potential in this field, and this is yet another area where we need to enhance their skills far beyond the present, so as to make the things much more meaningful. Next slide, please. Can I have the next slide, please? Oh. Yeah, thank you so much. So this is yet another credit. You see the soldiers on the ground. Already this was taken on the day we started the population-based age-stratified sero-epidemiological study in Islamabad zone, where it's a huge federal capital area, urban and rural. And you can see most of the FETP graduates very well dressed. And next slide, please. And one more thing that we started off much earlier in Pakistan, even we have 60 collection points for polio environmental sampling. And with the idea that we start collecting sample and looking for the virus, we utilize the sources and these FETP graduates in collecting the samples. And we have been very successful in not only getting the sample, but also detecting SARS-CoV virus. And as the virus appeared much earlier in stools and going down to the sewage, this is yet another alarm that we thought should play a role in finding the hotspots much earlier, and it has played very effectively as well. And with that, we have been doing the whole genome sequencing as well. And now we do have a primer synthesizer, first ever in the country, whereby we plan to launch much methodical research for the country. Next slide, please. Now, bridging the gaps, I think we have talked a lot about with what we did in training for the testing, tracing TTQ. We prepared the master trainers. The first cohort just completed yesterday, whereby the teams went all across the country and trained the master trainers. And we are starting the second category again on different line. So it's a continuous contact tracing, and the trainers of the master trainers that has been very evolving and very successful. Next slide, please. Now, just to conclude, the FELTP has been a huge source support during the current crisis, from data collection to all sorts of management, utilized in multiple capacities, served in far-flung areas, trained a huge number of master trainers, robust RRTs and prompt communication, and a great team. And why I've used all these colors, not to make the slide very fancy, just to shade, these are the colors of the rainbow. And once you combine, it makes the color as white. Next slide, please. And white is the sign of cleanliness, and cleanliness is godliness. And that's what we need to, because I think COVID has taught us the role of hand hygiene, and nothing but cleanliness. So that's what the message for everyone is. And as EMPHNET, once again, grateful, we all sail together. Thank you so much.
Thank you so much, Professor Amr, for the great presentation. Indeed, very, very useful and very rich indeed. And although you crossed the assigned time, but I'm sure everybody was enjoying the presentation. And we learn a lot from the experience on the amazing work that FELTP graduates and residents are doing in Pakistan. Also, I would like to highlight what you and Dr. Mohammed had raised during your presentation, that we had a lot of support that we have from different partners, indeed, CDC, WHO at country level, regional level, headquarters, and many other supporters. They are really give a lot during this pandemic to every country, as I'm sure of that. Now the other presentation will be from the other side of the region, from Tunis. We have with us Professor Nassaf. And Professor Nassaf Bouafif, she's the General Director of the National Observatory of New and Emerging Diseases and the Director of FETP in Tunis. In fact, after receiving her medical degree, she specialized in preventive medicine, public health, epidemiology, and biostatistics, and she got 2 master's degrees from France in public health and in the epidemiology, biostatistics, and modeling. And she has been the head of preventive medicine and epidemiology department at the Faculty of Medicine in Tunis. And also she became a full-time professor in preventive medicine and epidemiology and the head of research laboratory for prevention and epidemiology of non-communicable diseases. Dr. Nassaf, the floor is yours, please, to highlight the role of FETP in Tunisia. Please, Dr.
Thank you, Dr. Faris. I have the pleasure to present our experience in Tunisia. I will start by thank EMPHNET for giving us this opportunity to present our preparedness plan. And next, please. The general objective of our strategy is to limit the extension of the disease and to avoid that our capacity at the health system will be overloaded. For us, I will start by the next, please. Here, for our preparedness plan, it was composed with a different phase. The first phase of the preparation of the preparedness plan were conducted by our national team at the National Observatory of New and Emerging Diseases by the team graduated from Field Epidemiology training program. Immediately after the notification of the first cases of SARS-CoV in China, our team started working to revise the preparedness plan and also to start working on our crisis communication strategy. Next, please. Here we have different phases in our preparedness plan. The first phase, we start with the first version of our preparedness plan, and it was for us how to reduce the spread of the disease in our country with the preparation of the quarantine measure, how to detect early the virus, and also how to start the screening and the contact tracing. For each one of these main component of our plan, there is a team component by graduated from our FETP who were involved in this preparation of these documents. During the phase 2, when we start to get our first imported cases and after that our first local transmission cases, we start also to update our strategic plan. And in this phase also, it was the involvement of our FETP to revise all these measures. And for this, we prepared a lot of preventive measures to be implemented in at a different level, and we prepared our SOPs to implement all these measures. Next, please. After that, we get the phase 3 of our preparedness plan, and for this, after we get to the community circulation of the virus, then we start working on again to revise our response plan and also our communication strategy. I will after give you an idea about all these documents that were prepared by the FETP in Tunisia. Next, please. Here you can see that our preparedness plan and the response plan were essentially focused on the 5 early, the early detection of cases, the early confirmation of cases, the early investigation and the contact tracing. For these 3 steps were conducted by our FETP at the national and also at the regional level. And at the national level, we related to these steps, and we conducted a lot of training during the preparation step of our response activities. And also after that, we start working on the SOPs to cases and also all the protocols for treatment and take care of patients. Here, I would like to highlight that for this 5 early, our strength was related to the fact that we already conduct several sessions of training with our TFETP and also with the rapid response team, and we have trained about 120 persons previous to this outbreak. When we start with this outbreak, we were in the beginning of our 3rd cohort of TFETP. Then all those who were involved in this cohort, and also those graduated from previous FETP were immediately involved with us in all these activities. Next, please. Here, I would like to give you just an idea about the activities that were engaged during this response to the outbreak with the involvement of FETP and also the rapid response team. The first activity were related to point of entry surveillance and also the alert system, who were especially we have our graduated from different FETP who were involved to enhance the activity of at point of entry, and we immediately start training at all point of entry with our national team, and also a cascade training were engaged since the beginning of the outbreak. Also, we have a team at the national level and also at regional and local level who are involved in the investigation and the follow-up of patient, and also another team who are responsible of contact tracing. Also, we have another team who are engaged to follow up all the case who are who are at hospital, and also we have a team who follow up the lab activities, and also another team who are involved in the quarantine activities in the field. All these teams were working together with the supervision of our coordinator of FETP at the Observatory of New and Emerging Diseases, and also of all other members who are a part of the FETP. And here I would like to highlight that the FETP were the main people who are engaged in the FETP as mentors or as participants, were the main person who are involved in all these activities. Also, all scientific activities and all analyses conducted at the observatory and all training activities were also supervised by our FETP members. Next, please. Here, as you know, we implement different measures gradually, and we start by the isolation of all active, of all confirmed cases, and also the quarantine of all at high risk individual, and also we start the confinement measure. And here we have implemented some tools to follow up all these measures, and I will present after all these tools. Next, please. Here, just to give you an idea about our early response to the outbreak. Since 18 January, we start to implement the leadership team who are responsible of the organization of the response in the country, and also we have enhanced the capacity at point of entry to enhance surveillance. Also, we enhanced our early warning and response system at the observatory, and also we implement the tools to follow up all cases, and also we start by implementing the preventive measure. And here the most important was related to training activities who were implemented since this date. Next, please. Also, we start working with all laboratories to enhance their capacity, and also the capacity of our rapid response team, not only at the regional level, but also at the local level. And we implement a team who were responsible of all logistic issue, and also all the strategic to identify our strategic needs at the national level, and also to work with the region to identify their needs, and also we start working on our communication strategy. Next, please. Here, just to give you that for our early response, since 20 January, we start our first press release at that time. Next, please. Here, the idea about the different documents that were prepared by our FETP. It was the revised version of the preparedness plan, and also all SOPs related to all issues related to COVID. And here, it was the first version of these SOPs, and this the first version of our preparedness plan. Now we have updated all this version according to the evolution of this pandemic in our country. Next, please. Next, please. Just here, I am giving you just an idea about the organization of the response plan. Here, we have for the early detection of cases, the surveillance unit at the observatory linked to our early warning units at the regional level, who are working daily and during all this period to collect information about cases, about suspected, probable and confirmed cases, and also all data related to lab analysis. We have also another team who are involved in the risk evaluation, and we have conducted a lot of field activities, some investigation in the field, and some surveys. We conducted the first survey was a pilot survey to understand if the disease is spreading in our country. It was the first pilot study conducted with WHO to evaluate the circulation of the virus. And now we are preparing the national survey. It will be conducted in September to have an idea about the circulation of the virus in the country. Also, we have our rapid response team and the National Commission, the Scientific Commission at the Ministry of Health, who is giving all the recommendations related to the measure to implement according to the evolution of the disease in the country. And also we have started some research activity, and also we have established a mechanism to evaluate all these measures by doing some modeling and to evaluate all the measures that were implemented, and we have submitted some paper related to these activities. Next, please. Here you can see that the cycle of our revision of our preparedness plan. As you can see here, the central of our activities is conducted by people who were trained during the FETP, and also who were trained during different activities conducted by EMPHNET. And we are now in the phase to evaluate all our plan during this phase. Next, please. Here, just to give you an idea about all SOPs who are now prepared, and now we start a new phase to update all these SOPs during this phase. Next, please. Here, just an idea about the point of entry strategy. We start by using a new health care sheet that is implemented since January. And after now, we are using an online survey to use this sheet and to be able to track all people who are coming in Tunisia according to the evaluation of the risk of transmission in their country or in the country of departure. Next, please. Here, I am giving you an idea about the material that we have prepared since the beginning of the pandemic, and all this material was prepared by people who were from the observatory, and also those from the different regions, and also all those who were trained on risk communication during the last period of time. And we have conducted a lot of training on strategy of communication during the crisis, and it was very useful for us to implement this strategy when we get this issue. Next, please. Here, just an idea about what we have prepared during the first phase of our response plan. Next, please. Next. Here, during this phase, now we have started a new phase in our response plan. In this new phase, it is how to implement our preventive measure during the opening of our air travel, and we start now this new paradigm, who is how to be able to implement the prevent measure without going to the confinement, because we have a lot of negative consequences of the confinement, and also we cannot continue the closure of our of Tunisia in general, because this virus will survive with us for a long period of time. And also, now we are in phase to finalize this new strategy. The next. Our objective during this new strategy, how to avoid to get an expansion, a rapid spread of the disease, and how to avoid deaths during this phase.
Asaf, please, can we end with 1 minute, please?
Yes. Okay,
yeah,
then we go quickly. Quickly, here it is how to continue our strategy. You can go and quickly. Next, please. I will go just to the last slides, if you want. Next. Next, please. For us, the communication is one of our priority in this phase. And for us, we revised this communication strategy. As you can see, now we recommend the mask for use in general population, and also in we have established a new law to for this measure. And you can see here that we are preparing a lot of documents for this phase. Next, please. Here, all the documents that we have prepared during this phase. Next. Next, please. This is all documents that we have prepared. here, just to remind what are the main measure that Tunisia is using now. The first one is mask protection and physical distancing, and also how to activate or control organ. And in Tunisia, field epidemiologists are working in tracking all people who are at a high risk, and also they are doing a lot of work in the field for cluster investigation. As you know, I can just show you one slide related to the situation in Tunisia. Next, please. Next. This one. Here you can see the previous one, the last one, the previous one. Here, just the next one. Sorry.
Yeah,
here,
please.
just to show you that at the moment, after 27th of June, we start this new phase. And here you can see that we have several clusters that are now under investigation. We have a link between all these clusters in different governorates. Almost 20 among 24 governorates have a speed evaluation of the disease. And now our team are in the field conducting this cluster investigation. We hope that in the next phase, we will control this cluster, and we will continue this investigation. That's the last slide of this presentation. Here, just okay, previous one. Just to give you an idea, what are our forces in this investigation? That we have this regional unit of early warning, and that we have a lot of networking with WHO, with EMRO, with EMPHNET, with FENET, with Africa CDC and ECDC. Our strength is in our training activities that started since now at least 5 years, with the establishment of our FETP, and also the rapid response team that we have conducted with EMPHNET. It was very, very helpful for us, because we immediately deployed people who were training to be involved in outbreak investigation of the disease, in contact tracing, in contact tracking, in all field activities. And it is one of our strengths in this outbreak investigation. And we hope that we will continue this very helpful collaboration with all our partners. Thank you.
Thank you so much indeed, Dr. Nisab, for this great presentation indeed, and that highlight the important role that Tunisia FETP had played a role during this pandemic. In fact, due to the plethora of experience that we have seen in the region, Dr. Mohanad is planning to have another webinar really to highlight the work is done by FETP in other countries in the region. So hopefully we will see more and more experience from other countries. Really, they are very useful, and they are really a treasure for the country that need to be highlighted and that need to be as well documented, probably through some sort of case studies and scenarios, etc. In fact, we are lucky today to have also Dr. Abdel Hakim Al-Kuhlani. He's the director of Yemen FETP, as well as Dr. Sahar Sami. She is the executive director of Egypt FETP. So we will hear first of all a short comments really from Dr. Abdel Hakim, and then we will have some notes from Dr. Sahar as well. So please, Dr. Abdel Hakim, you are most welcome. Please.
Thank you very much. Can you hear me?
Yeah.
Okay. First of all, I would like to thank Dr. Mohanad and EMPHNET for organizing this meeting, and to thank the three speakers for their excellent and very informative presentations. Actually, I will comment on the role of the involvement of FETP in response for COVID-19 in Yemen. And when I talk about the cohorts, I'm referring to cohort 4 and 5, because the program is 9 years old in Yemen, and we already graduated 4 cohorts with 42 graduates, and we have now the 5th cohort with 11 residents. Actually, the FETP in Yemen was involved from the first day when the WHO declared that COVID-19 is a public health emergency of international concern. And we developed the national plan on the 2nd of February. The first issue that we took care of was the rapid assessment of the preparedness at the country level, at all levels. So we send our FETP residents and graduates to conduct the evaluation for the surveillance, for the points of entry, rapid response teams, because we have 333 rapid response teams in the country, in the north, south, east, and west. Also, they assess the laboratory capacity and the hospitals' preparedness and the coordination at the country level and at the governorate level. Also, they assess the infection control and logistics. And as you know, the current situation in Yemen and the national health system is almost collapsing. We were not surprised to have very low scoring of this rapid assessment. We found it very low, and this was brought to the attention of everybody, especially the leaders in the country. So according to that assessment, we conducted the risk assessment, and by the end, we assessed 29 points. They were very important points. And we found that the country is at moderate to high risk to import the COVID-19 with all the situation in the country and the sanction. So based on that, we developed the scenarios, and these scenarios were endorsed to the high level of the leadership in the country, and they approved them, and they worked according to these scenarios. According to that, we kept updating the plan, and the director of FETP and staff from the program, they were in the multi-sectoral committee, which was actually the kitchen for everything in the response for COVID-19 in the country. Also, Dr. Labiba and Dr. Muhammad Al-Imad, they were members of the scientific committee, and all the guidelines that have been developed in the country, I can say almost all, not all, they were developed by the staff of the FETP in Yemen. We established a hotline. It was under the supervision and control of the FETP, and most of the people in duty during the duty for the hotline, they were from the FETP program. Finally, the program was involved in most of the training, including the training for the surveillance staff in the governorates, also the rapid response teams, either the current or the newly established rapid response teams. Also, they were involved in the training for the case management and for the infection control. I don't want to take a lot of time and to leave the floor for the other to make comment or questions. Thank you very much.
Thank you very much, Dr. Abdul Hakim. Really, we are very proud of the work done by the heroes of Yemen FETPs, considering the complex emergency situation that Yemen is facing for the last few years. Indeed, hopefully we'll have some better news in the coming future. And now I will give the floor for my colleague, Dr. Sahar Sami. She's the Executive Director of Egypt FETP, also to say something about the peculiar activities that done by Egypt FETP. Please, Dr. Sahar, the floor is yours.
Assalamu alaikum. First of all, I want to thank Dr. Muhannad and EMPHNET for giving me this chance to say about the role of FETP in Egypt. I also want to thank my colleague in Tunisia and in Pakistan for their presentation. They were impressive, seeing that giving an idea about the FETP in the area. For Egypt, since they declared the COVID pandemic, there was multidisciplinary committee was developed, include representatives from different sectors and departments at the Ministry of Health, including epidemiology, surveillance, communicable disease, quarantine, central lab, and so on. Other ministries and partners are also involved, and the main goals for this committee is to fight against COVID spread. For FETP fellows, they participate in this committee. They participate in development and updating the national public health emergency preparedness and response plan. They also were invited as representative to attend the high-level coordination meeting with this committee, which was conducted on a daily basis at the Ministry of Health. The first preventive measures was in the quarantine procedures done for almost 400 Egyptian citizens evacuated from Wuhan. This was FETP fellows also participated in this procedure. They make the screening, the follow-up, and filling in data collection forms, and interviewing the arrivals. They participate also in the supervision and the infection control preventive measures taken during this measure. For the surveillance system, the fellows has a major role in enhancement of our national surveillance system, the NETs, through different activities such as developing and updating the standard case definition for the COVID. They participate in enhancement of the current respiratory disease surveillance system, ILI, SERI, and ERI. They also participated in the event-based surveillance to early detect, assess, and respond to acute public health event related to the COVID. The EBS activation focused also on collecting the rumors from a variety of sources of social media using the media scanning. Thanks to EMPHNET, in collaboration with EMPHNET, we have trained about 28 RRT. They were trained for emerging disease at the national and subnational level to respond to the COVID. RRT members were deployed across all the governorate to deal with contact. They collect clinical samples and send them to official labs. All contact information were line listed and filled in standard form. RRT members also are responsible for follow-up of the asymptomatic contact in their home self-isolation. They follow up persons who came recently from other countries for a standard period starting from the date of their arrivals. Some of the activities of the FETP were declined to the points of entries. They participated in implementation of some preventive measures, screening of the passenger, thermal screening, conducting rapid tests for detecting the COVID in blood samples, and interviewing the arrivals. Also, we have the emergency operating centers, which was developed and enhanced during these activities or COVID pandemic, where the FETP fellows are directing persons who have symptoms of fever, cough, or difficulty of breathing according to the case definition to the nearest hospital or chest hospital, transporting several suspected and confirmed patients to designed hospital for dedicated ambulance, follow-up of passenger arrived from all countries, and scaling up community outreach for health promotion and case management. We are also having the hotline, and in coordination also with EMPHNET, we were able to make some training courses for the hotline. They received thousands of calls from public on a daily basis, including reporting of the COVID suspected cases, complaints, inquiries about the disease symptoms, and preventive measures. At the beginning of the COVID attack, the hotline became so overloaded with thousands of calls. It reaches about 30,000 per day. And as a result, the Ministry of Health increased the capacity of hotlines through coordination of the private company with providing hotline staff training in relevant informations, and RRT members were involved in this process after being trained through coordination with EMPHNET. Central Lab was also another success story. We have almost 4 FETP graduates working on the Central Public Health Lab, and they were involved in the national response to mitigate COVID. The Ministry of Health introduced polymerase chain reaction testing at the Central Lab and the other 26 regional laboratories across the Egyptian governorates. Also, FETP fellows participated in infection control measures or infection control activities against the COVID. Other areas of success that we succeeded in doing or conducting national polio vaccination campaign during the COVID, and FETP fellows they are the one who participate in these areas.
Apologies, Dr. Sahar, you have less than a minute, please.
The last thing I will discuss is the research. We are now conducting some of the researches about contact tracing or psychological impact on the healthcare workers in coordination with WHO and the EMPHNET. And thank you.
Thank you. Thank you so much, Dr. Sahar, for elaboration on the role of FETP in Egypt on the COVID-19. Now, may I ask my colleague, Ms. Heather, to take the part and to respond to the questions and answer that we had received from the attendees. Please, Ms. Heather, let us start.
Thank you. Thank you so much. And thank you to our presenter, Dr. Muhannad, Dr. Ahmed, Professor Nassaf. Really, really wonderful presentations, and appreciate you sharing the wealth of information with this group. I apologize that I am not on the camera. I'm recently posted to Oman. I moved from Jordan. I'm the new CDC Regional Director, and I'm having some challenges getting around some of the blocked media in Oman. So my apologies. I feel rude not being able to be on video like the others. I really appreciated hearing these presentations. I think they speak to the diversity of the region and the diversity of skills and abilities that we have in the region to be able to address issues so complex as COVID-19. The impact of our FETPs and rely very much on the work that they're able to do in the field. So it was really great to sort of see this lined up, especially with attention being paid to particular emergency response pillars. I'm going to open it up to questions. We have a lot of questions, and I realize we don't have a lot of time. One of the wonderful things about being able to facilitate a session is that you actually get to ask the first question, which I'm going to. I'm interested in hearing from our colleagues how you manage, or how you what your experience is with FETPs in terms of being able to influence and direct the prioritization of activities vis-a-vis your colleagues in the Ministry of Health. It's a really important relationship and collaboration, and I'm just wondering how FETP is get in there and help to influence some of the prioritization of activities, particularly around COVID, when there's a lot of competing priorities and a lot of competing interests and a lot of unmet needs. So I'm interested to hear from some of our speakers and our colleagues on the line how that would be addressed, and then we'll move to some of the questions that are in the Q&A box. Thank you.
I think we can direct this question to Professor Amr. Professor Amr is there?
Sorry, can you hear me now?
Yeah, please.
I'm sorry, can you repeat the question? There was a little bit of breakage in voice at the last place.
Oh, sorry. I'm just interested to hear how how you're able to influence the prioritizations of activities in the countries vis-a-vis history of health.
All right. Thank you so much for repeating the question. Ours is a big country. It's heavily populated, 220 million plus population burden. And definitely we need very motivated people who are either blessed with the qualities, or you need to abreast them with such qualities in order to make them run around. Formally, as mentor, as I said earlier, I take them as my children, and it's my duty not only to teach them, but to mentor them to a level where they are capable and abreast with all such characters and moral duties. And that's one of the region, I think, where again, as a leader, it's my duty. And then I am blessed with a very nice faculty along with me. All credit to the faculty. I just am sitting over there, and it's the faculty which moves around and then takes them into the confidence, and then they can move around. And the motivation, definitely, you need to incentivize them one way or the other. But well, there are different forms of incentive in talk very briefly. As you understand, it could be either monetarily benefits, it could be other promotional benefits. For me, the actual success has been definitely, it's not the monetary, but to make them at a level where they can be, because all of them are government servants. So putting such things to their credit and to the criterion of their promotion as well, whereby if we see our own NIH, we have included such cadres of FELTP as one of the incentives for promotion to the next rank as well. They do serve. But I am a true believer, not that I'm a soldier myself, it's your words which can make a difference. And my personal experience, and that's what we have been sharing even with the hierarchy coming down to the best possible level, it's the most motivational communication that makes the difference. And that's been the main success for getting the things done out of these cadre of FETP graduates and fellows.
Thank you so much.
Thank you.
So as we move to the Q&A, the questions that are in the chat box, the Q&A box, I notice a lot of the questions are really geared toward sort of big picture around EMPHNETs and supporting regional EMPHNETs, both how do we support those that are already in place, how do we grow the FETP and RRT networks in the region, and scale up what's already happening. And I know this is something that has come up a lot, especially as we start to look at what a fantastic resource is. I don't know if Dr. Mohammed, if you want to address some of the questions, broad questions around scaling up and decisions around how the type of FETP is decided on. Recommendation for increased engagement around FETPs be? Thank you.
Thank you very much. Let me start by saying that until establishment of EMPHNET, the region has only 4 FETPs in Saudi Arabia, Egypt, Jordan, and Pakistan. Later on, in close collaboration with Centers for Disease Control and Prevention, CDC Atlanta, we could escalate, the process of establishing new FETPs. Nowadays, as I said, we have 10 FETPs, and we have more willing countries. They want to establish their own programs, like Lebanon, like Somalia, and other countries like Qatar as well. So this was a long journey, and we see that the region now has more concept and better understand the concept of applied and field epidemiology. Recently, based on joint evaluation external missions, it was obviously shown that the countries need its own programs and FETPs. Now, how we select the best modality for the country, this is something we do jointly, of course, with CDC and with the country as well. So it depends on their needs and depends on their modality and what's what exactly we need to strengthen which part of the health system, especially the workforce component within the health system. So when we started, the modality was 2 years programs in the majority of the country, but recently, you know, due to sometimes the emergency situation, it became, you know, we start thinking about different modalities, about FEP, which is a frontline program, sometimes about 1 year program. So this is something that we do assessment, you know, joint assessment, and we decide with the country the best option. For example, Tunisia, it was, you know, with the country work, it was decided that the better option for the country, you know, to go with 1 year programs. So Afghanistan, the same. For other places, you know, it was much better to go on the front line as a beginning than to scale up this modality as much as the country needs for that. So this is in general. Thank you.
Thank you very much for that answer. I'm going to direct this next question to Professor Nassaf, because I noticed toward the end of her presentation really wonderful messaging that's been developed in Tunisia. I know there are several questions on the inbox asking about how risk communication can be integrated into the response, and how FETP can play a larger role in terms of supporting communication, especially in countries where we have resource challenges or, you know, in conflict settings. So I don't know if you want to talk a little bit about your experience in developing the risk communication, because I do think it's a really important piece, and we're seeing it, we're seeing the impact of good risk communication messaging throughout, and poor communication as well. So I'm interested about that. Thank you.
Thank you for this very interesting question. In Tunisia, we start working on our communication strategy since now 5 years, and we establish media training activities in Tunisia at the beginning, and we have conducted a lot of sessions with all the region in the country with the different expertise and different experts from different country. And after that, we established a different session with Africa CDC. And also when we have conducted the rapid response team training, we integrated risk communication in our training with EMPHNET, and also in our FETP, we integrated this risk communication training and media training in our activities. Then when we start with this pandemic, we already have people who are trained in risk communication and also in crisis communication, and we invited all of them to participate, to elaborate our, to update our strategy in Tunisia, and to work with us to prepare all this material for the communication. And also we divided people from community communication, general communication, and to prepare also our press release. It was a team working together, and until now we have established this team. They are working in a daily way to prepare all documents and for media, and also they are updating all the material in the field. And our other thing that we have people who are in the field conducting this community-based communication, giving all the advice to the population, and it is a continuous way of working for us.
Thank you very much for that response. Very helpful, very important topic. I'm cognizant of the fact that we have about 5 more minutes. I want to make sure that the Q&A session also touches on the really important component of infection prevention and control. And one of the questions that was asked that I think sort of helps drive some discussion around this is what initiatives, what activities are in place to be able to support our residents when they're in the field doing so much, you know, the ground response work? What, you know, how are we working with that group around issues of, to support IPC, and, you know, the larger issue, which I think everybody, many people in this region would agree is a challenge, is regional support for our health workers. And I don't, Dr. Amr, if you want to take an initial with this, or our colleague from Egypt or Min one it would be helpful. Thank you.
Yeah, thank you so much, Hita. I think that's I said in my present, one of the main challenging areas, because you're exposing your frontliners. And I think the reality, the actual worth of the frontline healthcare workers has been realized during COVID crisis, at least to a greater extent, if we see our own culture, if we see our own developing country and other countries in the region as well. Definitely, you have to be, for any chem bio eventuality, it is always said that you cannot prepare during an eventuality, you have to prepare before any such eventuality. Well, having said that, that's the motto for CBRN, but coming down to a stage where the actual eventuality was on the ground, and definitely all paramedics and even all the doctors are not well abreast with such a latest knowledge. And I think the most important component was the PPE, the donning and doffing. It's not only the availability of the PPE, but how to put them in and how to dispose them off and take them off. These are very, very important. And one wrong action can unfortunately expose the frontline worker to the virus. And this, unfortunately, we have witnessed in all well-developed countries as well. In our country, around 300 plus paramedics getting infected. Unfortunately, some of them lost their lives as well. What we did was that we had launched the national guidelines for IPC. We modified them for the COVID alone. And the time it started in China, we started preparing the paramedics to the best of our expertise. And as I showed you, one of the departments that is continuously basically monitoring, not only assessing the hospital in the line of WHO parameters, but also imparting training and information. And through the continuous helpline, we are getting back to them with all the latest knowledge that they need to exceed. And as I said earlier, infectious waste, the donning, doffing, we are demonstrating them online now. Previously, before 26th of February, and even during early days of March, we were having hands-on trainings as well. But now, and we used to send teams all across the country, but now it's mostly online training. And to quite an extent, we have been successful. And then the ministry launched a program by the name of eCare, whereby 100,000 have to be trained through the combined efforts of Health Services Academy and National Institute of Health and FETP program. So this is a combined effort that is ongoing, and it is, I being myself a specialist in IPC, I understand that it's difficult, but I think it's our duty to keep importing, and very brief, meaningful SOPs are very methodical approaches that you should have very brief and simplified version of SOPs for them to follow if they have not been trained previously. I hope that suffices.
Thank you. Thank you. I'm going to ask one follow-up that I know we're tight on time, so I'm hoping you can kind of this one quickly, but it's important, especially in the context of Pakistan. Can you tell us what the greatest challenges are for sampling activities with the Pakistani team?
So it's again back to me?
Just as we're talking about, you know, larger team activities, what do you consider the greatest challenges for the sampling activity for the Pakistani teams?
I think this part has been taken very well by our teams. We started off with the master trainers as far as sampling is concerned, because considering the two processes, we have been banking upon PCR, so it's either the nasopharyngeal swab or the oral swab. To a certain extent, we did face a problem in taking the nasopharyngeal swabs. That was a more so a technical challenge because people were reluctant to give the nasopharyngeal swab as compared to the oropharyngeal swab. So we started strategizing how to work up these modalities. So we trained the staff at NIH, and that's basically we are the national referral lab. And we took all the provincial labs and the provincial main hubs, not only from the public, but the private sector into loop. And we started training them for taking the samples. And more so was basically the health aspect of the samplers as well. So we started training to the best of our possibilities and expertise, giving them training and actual drills and triage. And after that, it's online now, but we have been successful in making them understand that how to take the sample, how to protect themselves, how to deliver the sample. And would you believe during this crisis, we even launched a new guideline, national guideline through Ministry of Foreign Affairs for transporting the samples. So I think as the gaps have been there, we have been able to plug them during this crisis as well. Oh, please.
Thanks so much. As I look through the questions, there's so many really great questions being asked, and unfortunately we don't have time to go through all of them. I'm hoping that we might be able to compile these questions. I'm sort of hunting this off to our FET, our EMPHNET leadership, and hoping that we can kind of get some answers to the questions and be able to reply back to the group because we don't have time to go through all of them. But I want to thank our speakers and it's really a lively discussion, wonderful turnout, and that's great to see. And it was really my pleasure to be a part of this and to really hear about all of the resources that we have in this region. It's exciting me. I started back in 2004 when we put L in the FETP Kenya, and that was a very exciting time. So to see all of the activities that are underway in this region makes you very, very proud of the partnerships and the collaborations and the support to the ministries of health that's being provided by EMPHNET. And with that, I'm going to turn it over. I don't know, Dr. Lamy, any last minute words to say to wrap it up?
Thank you so much, Heather, for running these questions. And unfortunately, we didn't have the time to cover them. Also, hopefully, we are going to manage this when we do some sort of probably by text, we are going to respond to all these questions, and we are going to make a summary of all these presentations, and hopefully we will disseminate them to all the attendees. At the end, I would like to thank all the great presenters, really, Dr. Muhannad, Dr. Amar, and Dr. Nassaf, for you did marvelous job, and my thanks and appreciation also extended to Dr. Abdul Hakim and to Dr. Sahar for their input, and hopefully, as I mentioned, we are going to have another webinar to highlight the activities made by other FETPs in the region. As I mentioned, there is a wealth of expertise and a lot of experience that we had over the last 8 months since the inception of this pandemic, and it really, we have to get use of them in a very very efficient way indeed. At last, I will give Dr. Muhannad just 1 minute before closing to say the last words. Please, Dr.
Thank you very much. I just want also to thank the facilitators for facilitating our session today. Thank you, Heather. Thank you, Dr. Faris, for all this support. And of course, thank you for our speakers and attendees. We know how much is difficult these days, and thank you for finding time to contribute and participate in our today's sessions. Thank you very much.
Thank you all. Thank you so much. Hopefully we'll see you in another webinar. Bye-bye.
Bye-bye.
Have a good day.
Thanks, everyone.
Thank you. Bye-bye.
Bye.